Now, when we go to the risk factors for victimology, one thing I want you to keep in mind is that victim behavior and circumstances generally fall into just the three levels, low, medium, or high. And these levels are evaluated along what's known as a victimology continuum, which considers the victim's environment, the situation itself, and the circumstances. I have taken this model from a book called Cold Case Methodology by Cooper and King, and it has remained quite prominent over the years, and is one of the most useful frameworks that investigators have to utilize. So when you're assessing victim risk, there are several questions you should always be asking yourself. Was there any pre-crime association or contact? What was the degree or extent of that relationship, if one existed? Was this person a victim of opportunity, or were they specifically targeted? Did the victim contribute in any way to their victimization? And of course, if so, how? For example, was it due to their ignorance, not knowing? Their own innocence, again, not knowing, not realizing they were in a danger spot. Naivete or recklessness on their part. Or pure negligence, and there again, maybe even a total disregard for risk. You also need to think about the degree of any pre-planning or premeditation and forethought that might have gone into this attack and subsequent death. Was this a crime of passion? Was it an impulsive act? Or was it something that unfolded spontaneously? Then look at the offender side. What level of criminal experience or sophistication are we seeing, for example, in the crime scene or in the manner in which the victim was killed? What was the motive, or do we see anything indicating that to us? Was this victim the intended target again, or a substitute for someone else, either by chance or by design? What was the offender's attitude toward the victim? Can we tell that from looking at the scene or the injuries on the victim? Sometimes we can. Now, keep in mind, these are not academic questions. These are investigative questions that need to be answered, if at all possible, during the course of putting together the victimology and the suspectology assessments for your case.